With 33 health centers spanning Silicon Valley, the coast, the Central Valley, and even out to Reno, Planned Parenthood Mar Monte conducts over 500,000 client visits per year. Planned Parenthood reaches people through medical services, education programs, and advocacy initiatives to ensure that community members have the information and resources they need to protect themselves and their partners and make smart decisions about their health. I'm pleased to welcome Jill MacAfee, Director of Laboratory Services and Clinical Trials at Planned Parenthood Mar Monte, who's here to discuss HIV research and testing that Planned Parenthood has been doing. Jill, thank you so much for joining us.
Thank you.
We're so glad to have you here. Let's start with the importance of HIV testing. How often should a sexually active person be getting tested for HIV?
Recent CDC guidelines have stated that everyone should actually be tested once a year. And if you have multiple partners or a new partner, you should make sure that you're tested and your partner is tested before you start having relationships.
Okay, so really then it should be part of our annual health care.
That is what we're trying to do, is destigmatize testing by making it as routine as having a regular chemistry test or any other blood test that you get every year for your health.
Okay. Now, Planned Parenthood has implemented the rapid HIV test. How is rapid HIV different than the test so many of us have had?
Rapid HIV testing was started at our affiliate about a year ago, and it is something that has become very popular with our staff as well as our clients. The test is a 10-minute finger stick poke. One poke, wait 10 minutes. And so we talk to our clients in counseling. Then we start the test if that they so choose. It goes out of the room while we complete our talking with our client. And then the result can be retained right away and given to the patient right there, so they don't have to come back. And that's really what's different, is you walk away with your result and you don't have to come back in 2 weeks to get. And it's important to know that no test is perfect, and that if the test comes out reactive in the clinic, it doesn't necessarily mean that a person has been infected. It just means that they need to have another test.
Okay. Now, we all know that it's important to use condoms when engaging in sexual intercourse to prevent the spread of HIV and other STDs. But what about using condoms and dental dams for oral sex as well? Right.
It's generally recommended to do that for the safety of yourself and your partner. And we actually have a wide variety of condom types at our clinics, and I brought some with me. We have our own Planned Parenthood brand now. It's called Proper Attire, and the slogan is "Required for Entry." So we have our extra large, we have color.
That's fabulous.
And a basic, and we also have one called, there's a sheer, and we also have dots. So
that's fun.
A little more fun way to get people interested in trying out condoms and finding that they can be fun.
That's awesome. Now, Planned Parenthood has been participating in some research studies as well around HIV, correct?
We have. As we are very familiar with the California Microbicide Initiative, and I'm on that steering committee. A microbicide is a foam, a gel, possibly a cream, or an insert that is being developed, and it is in early development, to prevent the transmission of HIV to women, and especially for women who are not empowered to do so. For instance, in African countries where the husband may not approve of a woman protecting herself. The research has had its ups and downs. More recently, it's been a little on the downside. Other than the positive research is in the area of probiotics, which I know everybody's hearing about, and keeping the vaginal flora normal and healthy, which helps your immune system protect yourself against infection.
Okay. Often it is assumed that Planned Parenthood only serves women. And that's not true, is it?
No, it definitely is not. Especially with the advent of urine testing for chlamydia and gonorrhea and the rapid test for HIV, we encourage partners to come in together or make separate appointments, whatever's comfortable, to be evaluated for not just HIV, but chlamydia and gonorrhea, and any of their healthcare needs for men as well as women and children and people of any age.
And what additional services are provided for men or women at Planned Parenthood that some folks may or may not know about?
For example, if someone says, I would like to have an HIV test, that is really a signal to us that we need to talk to them about all the other infectious diseases that they may have picked up, because what puts them at risk for HIV is also putting them at risk for other infections. We also have clinics that do primary care and take care of chronic conditions, as well as well child checks and immunizations.
Okay, yeah, those are all services I don't think a lot of people know about. I mean, you even do cancer screening, correct?
Yes, we do.
That's amazing. And recently also, I believe all of your health centers have online appointment requests as an option.
Yes, we
now?
do. If you go to our website, which will be listed in a minute here, you can make requests for appointments, and someone will call you back to schedule that with you.
Well, that's wonderful. Thank you so much for being here today with us to talk about this really important topic. And for those of you who would like more information, you can visit the URL that's listed on your screen right now.